help use for EMTs and for paramedics. We've come a long way. When we were here in the villages in, I believe, either March or early April, we were setting up test sites, trying to get as many people access to diagnostic PCR tests as we could, and we were able to get a lot of seniors to come through here. The villages have handled this very well. They've really worked to provide a safe environment for their residents. We're now in a situation where Florida has vaccinated tens of thousands of people, at least for the first dose. We're to continue making progress there. And we now have this light at the end of the tunnel for our elderly, where you're going to have, in relatively short order, access to a safe and effective vaccine. Let me just say, finally, before we get on to the main show here, we have in the state of Florida people 65 and over, about 4.4 million residents. 70 and over, it's about 3.12 million residents. And so as you look forward about the vaccines being allocated, we are not going to have over the next 6 weeks 4.4 million doses for individuals. We probably will have a couple million. We'll see how that works. And so what I would say to the elderly population, it's going to be reserved for you, but not everyone's going to be able to do it on day one. It's going to take some time to be able to make sure everybody has access. We're going to work very hard at the state to provide whatever support we can to our healthcare providers to be able to make this happen. But this is something that over the next 6 weeks, 8 weeks, we should be able to make huge progress on. I wish it was as simple as just doing it overnight. That's not necessarily the case, but just understand if you're talking just 70 plus, we got 3.12 million. Not everyone may want it because, of course, it's not mandated, but I do believe most will want it. And so we want to make sure that we're working to be able to provide that to the folks who really want it. And with that, we're going to be able to witness, I think, the first vaccinations for, we both have some healthcare workers, but then we also have some members of the community, right? So how are we going to do it? Are we going to do both groups?
We're going to do both groups.
Okay, so are we going to do the healthcare folks first?
Yep, we're going to do, they're both going to sit down.
Okay.
Healthcare first, community member.
Okay, so we've got members of the...
And healthcare and community member, and then our vaccinators.
Okay, so who's a community member? Okay, we got one who's...
And then,
So we got 2 members of the community. We got 2 members who are working in healthcare, and so they're going to be able to receive vaccination. So you guys want to take it away? Okay, we got a couple more rounds, all right. How you doing?
Hey, Governor, are these Moderna or Pfizer?
Pfizer.
Fine, thank you. That's quite all right.
All right, thank you. Yeah. How was it?
Great.
Good. Okay. Just come back in 21 days now. All right.
How you doing?
Good.
Senator Baxley, did you get offered to come do this or what?
There's another plan for me.
Okay.
I am right-handed. Is that better? President. Should I go over there? For the old guys.
Okay. Well, good. When are you guys doing that? Hey, how are you?
It's all
Barbara, sit right here.
Okay.
Barbara, sit right here for me.
They don't want us to hurt the quorum.
Barbara, you can sit right here for me, okay? All right. Good. Thank you. How are you today?
I'm good. How are you?
I am. This is a typical clinic time. Yeah, we do about this.
What's
much.
that?
Nobody's screamed yet.
No, it's been good, and I think when people see you guys doing it and there's no problems, then more people want to take it. So thanks for volunteering.
All right.
How about you do my resume?
Yes, ma'am. I do not mind. I'm gonna come to that side. I just need you to hold the Band-Aid for me, just like this. Awesome.
Is it over?
Easy as that.
Anything is happy.
All right.
Thank you.
I'm gonna-
Thank you, guys.
Oh, thank you.
I'm gonna put that on your lap. Can you hold that up for?
Sorry to be happy.
Congratulations. You're good. You're one of the first. There you are. Thank you.
All done. Yes, ma'am. You're very welcome.
Merry Christmas.
You too. You have a very lovely Christmas.
Yep.
How are you, Barbara? Wonderful.
All right.
Your arm for me?
Hello.
It's not pulled out.
You all good? You all done? Doesn't matter. Doesn't matter. Yeah, I'll get you over here.
Stay right there. Give me 1 second. All right. Hold 1 second.
He's already going home.
Yeah, I know he's running. He's not going home.
Big bud?
Well,
A little bit.
Okay?
okay.
Not yet. I'm gonna put the Band-Aid on you. All right, Miss Barbara, you are done then, okay?
Thank you.
You're welcome.
I don't know where I am, but oh, there he is.
There, you find him? All right.
You guys are very efficient. That's a lot of people in a pretty short amount of time. Great job. So what was that, like 10 minutes to do all those people? Now, what did they have to do leading up to this? Like, did they have to fill out a form, or how did you?
Yeah, they fill out a consent form, and then they get the information from the EUA on it, and then some other information on how to report any allergic reactions from that. I then reviewed all of their history with them, making sure that this was safe for them to get.
And then, do they now have an appointment to come back in 21 days?
Yeah, while they're sitting for their 30 minutes that we're going to monitor them, we will fill out their CDC card so they'll have that information, and then we'll book their next appointment for their next vaccine.
Oh, great. Well, good job. I know you guys are going to have many more of these to do in the coming weeks and months. So, well, we appreciate UF Health. Thank you guys for really leaning in. Anytime there was anything that was needed here, they were on top of it from the very beginning with the testing and all the way now to the vaccine. So it's exciting. Got a lot of work to do, but I think that there's a good, strong light at the end of the tunnel. With that, yes, sir.
Governor, Orange County Public School Superintendent Barbara Jenkins has sent a letter to your office asking that teachers be moved towards the front of the line, not first in line, but towards the front of the line. What do you have to say about that?
Well, I think once we offer it to elderly, and particularly if we get a Johnson & Johnson approval, which is one dose, I think you're going to be able to offer it broadly. And I think some of the key areas, whether it's law enforcement, fire, whether it's teachers, I think that they will have access. Obviously, any teacher that is elderly would be included in the overall elderly population. But we want to make sure that we're giving the access to the elderly first. And that's just a basic matter of the data and how the disease has affected different age groups.
Just to be clear, that some of the folks here that are not healthcare workers, they're not in assisted living facilities.
No. So these are probably the first members of the community who are senior citizens to be vaccinated. Maybe anywhere in the country, but certainly in Florida. So this is kind of a preview of what we're going to be seeing an awful lot of, hopefully, over the next weeks and months.
But just to be clear, like my mom couldn't go get a shot tomorrow.
Well, not tomorrow, but this is going to happen pretty soon. I mean, once we get the allocations, I mean, I think we've worked through a pretty decent chunk of the frontline healthcare workers. Like I mentioned, we've done over the 100 facilities in Broward and Pinellas for long-term care. CVS and Walgreens is working through. I think they've picked up the pace. So you will probably, I mean, let's put it this way. We want to be able to offer it as soon as we can. It's not going to take it's not like this is 3 months away. I mean, you're going to have enough vaccine to begin going for the senior population. And I also said at the end, just understand with the numbers we have, I mean, we have a lot of folks. So you say over 3.12 million, how many of them want it? I mean, let's just say 75% want it. You know, that's a decent chunk of people. We'll probably have enough vaccine over the next 6 weeks for that. But we're probably, the way it looks, probably not going to have 4 million doses by February 1st.
With the snowbird season, are full-time residents going to have priority over people that might live elsewhere here?
Well, we have not necessarily done that. I mean, we'll see.
To her point, though, if somebody sees this on the news tonight and thinks, oh, these people are getting it, I'll be able to get it soon. What's the time frame that you can tell these people that it might be in the future?
So we are hoping that with the allocation coming up for the coming week, that the bulk of that will be able to be devoted to elderly people. Now, this is hundreds of thousands, which is a lot, but you know the numbers there. We're also working with the hospitals about efficient delivery. Now, once they get through their healthcare workers, they obviously already have some system in place to be able to vaccinate people. So I think you'll see some of them. We're reaching out to the community. As I mentioned, we're probably going to do some community pods, working with some of the state health, the county health departments, and so you'll start to see that. So I would just say, if you're in the elderly population, this is coming soon, and just stay tuned. There's going to be more information coming, but we're a lot further along than we thought we would be 6 months ago, and that's a really good thing.
Are we talking 50 and over, 60 and over, 65 and over?
Oh, it'll be, it's going to be people that are considered high risk and elderly. I mean, I think if you look, if you compare a 51-year-old to a 73-year-old, there's a radical difference. Not saying that if you're 51, no one's had complications. Obviously, that's happened. But if you look, the higher you go on that age scale, the more you've seen mortality. Yes, ma'am.
So, Governor, when you say high risk and elderly, by high risk, you mean maybe someone who has a long history of asthma but is 40 years old. They could get vaccinated.
We're saying the elderly are higher risk. We're focusing on the elderly. It is absolutely true that if you're 40, you could have some comorbidities. The problem is, how do you administer that? And do you want to have the hospitals having to slice and dice everyone's comorbidity? We believe if you look at the numbers, someone 40 with comorbidities, if someone's 80 with those same the person that's 80 has much higher risk. So we're going to focus on that. We'll focus on it based on elderly and age, not necessarily health status. And the reason for that is just efficiency. It's clear. And as I said, with the Johnson & Johnson hopefully being approved in January, we're not too far away where you could have a one-dose vaccine that'll be even more broadly available. We thought about doing the comorbidities, but I just think functionally when you get into how do you do that, do I say this person's comorbidity counts and this person's doesn't? And if you look at the mortality, 80%, 82% of the COVID-related mortality is people that are elderly. And so if you can get a huge amount of those people vaccinated, you are going to reduce that mortality. You'll reduce the people coming into the hospitals, and that'll really, I think, be the most effective public health strategy to be able to do. So that's where we're going, and we look forward. There will be more information shortly, but I think the top line for today is, given that there's some confusion about who should be kind of in line first, some say some of the younger workers even, just want to be clear, in Florida, we've got to put our parents and grandparents first, and that's what we're going to be doing, and we're going to work like hell to be able to get all the vaccine out to elderly who want it. Thanks very much.
Just to be clear, what is elderly? What age does that start at? What age does elderly start at?